So for me, overrated advice is focusing on anti-aging. It really is about pro-aging, aging well, more health span than lifespan. And underrated is we under-focus on what the internal changes we can make to make ourselves look more beautiful.
So one overrated thing I would say is don't blame me about this, but screens. Screens are not great for sleep, but I think people blame everything when it comes to sleep on screens. And then the most underrated, I think, is consistency of sleep-wake timing. So it's quality and consistency, then work on quantity.
I think the most overrated is folks thinking that they need like 10 to 20 supplements to stay healthy. I like supplements, I talk about supplements, but honestly, you're not doing yourself a service if you're taking about more than 5 or so. I think the most underrated is the role of our emotional health and cortisol, quite honestly. I think older systems of medicine talked about this. They talked about how things like grief and trauma and sadness and worry live in the body and how they trigger inflammation and over time create disease. I would say that the most overrated approach or reaction or interaction that providers have with patients when they're not feeling well and they do a set of labs and everything looks normal is to tell the patient that they're depressed or that something that they're doing is making them feel unwell. Overrated is again trying to explain anything with one unifying diagnosis. We don't need to stick with that. There are multiple things that